Welcome to the Mountain View Safety Services Exposure Control Plan for Bloodborne Pathogens. Policy and Scope. This policy is to ensure that the occupational first aid attendants are protected from occupational exposure to bloodborne pathogens, and that it is done in a manner that complies with WorkSafe BC and occupational health and safety regulation. This exposure control plan covers all OFAs, as it is reasonably anticipated that they will have contact with blood or other potentially infectious materials as a result of performing their normal job duties. Purpose and responsibilities. The purpose of this exposure control plan is to eliminate or minimize the OFA's risk of occupational exposure to bloodborne pathogens and OPIMs, as well as to reduce the risk of infection should exposure occur. Management responsibilities. Conduct the risk identification and assessment of the OFA's potential occupational exposure to bloodborne pathogens. Implement safe work practices and written work procedures to eliminate or reduce the OFA's potential exposure to bloodborne pathogens. Provide OFAs with appropriate personal protective equipment. Ensure OFAs are provided with education and training on bloodborne pathogens in the exposure control plan. Provide OFAs with the hepatitis A and B vaccinations upon request. Ensure that all pertinent records are maintained. Ensure that OFAs who have had an exposure incident to blood or OPIMs are medically evaluated, then seen by a physician for follow-up if deemed necessary by the medical evaluation. Ensure that incident investigation of OFA's exposure incidents to blood or OPIMs are conducted and corrective actions are taken to prevent similar incidents from occurring. Annually review the exposure control plan and update it as necessary. OFA attendance responsibilities. Follow safe work practices and written work procedures. Wear the appropriate personal protective equipment provided. Attend education and training, occupational first aid training courses, and additional company training sessions. Follow the post-exposure health management procedure in the event of an exposure incident to blood or OPIMs. Participate in incident investigations of exposure incident to blood or OPIMs. Risk identification and assessment. All OFAs have the potential of occupational exposure to bloodborne pathogens. OFAs may have harmful contact with blood or OPIMs via percutaneous injury, mucous membrane contact, non-intact skin contact. It is reasonably anticipated that such contact may occur when attendants are rendering first aid, performing post-treatment, and/or during incident scene cleanup. Control procedures. Although first aid kits and equipment contain only a few items that could break through the skin, OFAs must always watch out for other sharp objects that may be encountered and pose a risk of percutaneous injury, for instance, contaminated broken glass at an incident site. Sharps containers are located in the first aid room for discarding disposable, contaminated sharp items.